Thinking back through our practicum and then looking back through the journal notes about what I had kept track of, what I found was interesting throughout the different modules, there were several things that I thought were evident and very noticeable that took place in my practicum site. In the first module, we discussed healthy work environments, and a huge issue that was brought up was a nursing shortage. The Journal of Nursing Management discussed the nursing shortage and how the shortage affects the patient-centered care. It was obvious in the different units at my practicum site that the units were short-staffed. There were ICU nurses that had more than 2 patients. Due to the shortage and high demand workload, it becomes apparent that the nurses aren't able to spend as much time with the patients, and therefore how would they notice a change in the mental status as quickly as they would if they didn't have such a heavy workload. Second, we talked about communication throughout the entire course, I felt like. And it was also discussed in the Team Steps article that no more than one person can communicate without effective communication. It sounds so simple, but there's such a lack of communication in the healthcare field. If the team members cannot communicate effectively, it ends up affecting the patient's prognosis and their outcome. Team members should be able to talk openly about their concerns, their findings with other members of the team, since team members have the same goal, the patient. At my practicum, I set in on several roundings in the units, and they all use the same rounding tool, which is on the next slide. They talked through the sheet with the same goal and objective, being the patient and what changes could be made for the patient to have the best outcome. As evident in this sheet, the rounds cover multiple aspects of patient care, and in the neuro section, it mentions the CAM-ICU and gives nursing care for the patient, and gives the nurse caring for the patient the option to mark the patient as CAM-ICU positive or CAM-ICU negative, which would be evident in them having delirium or not having delirium. Next, it kind of ties into the communication and the rounds that I set in on. The interprofessional teamwork was noted in my practicum in the roundings with the multidisciplinary team members. The rounds consist of physicians, nurses, physical therapy, case management, pharmacy, dietary. Anybody actually that was there that wanted to set in on it that actually cared for the patient in some way. During the rounds, we talked through the sheets and everybody voiced their opinions and communicated really well from what I had seen. We round twice a week with a critical care intensivist, and then we're also going to start rounding 3 days a week with the critical care intensivist, physician assistants, and the nurse practitioners. During the rounds, we all shared a clear purpose with the patient's outcome being the goal, and the goal of the rounding is to end up with the patient receiving better care. Lastly, the thing that I thought related well to what we learned in class to what I noticed in my practicum was information technology. It's such an important aspect of healthcare delivery, and it is really up the ante, I would say, for the delivery of healthcare that we're able to give. Electronic health records or electronic charting has really helped with the overall quality of care that patients receive. It gives the care providers the ability to look at test results, evaluations, orders, and other information when they're not even in the same unit that the patient's in. They're able to develop their plan without ever laying eyes on the patient, and that can be beneficial for them, seeing as they're caring for more patients than nurses ever thought about caring for. This is core for evidence-based decision-making, continuity of care, and patient safety. The electronic health record provides assessments, actions, and evaluations for a life trajectory. Every team member that I had seen when I was doing my rounds in the different ICUs had up the electronic health record and was looking at the documentation and doing their assessment so that other members of the team could see it, and therefore how the patient's going to receive the best care.